morning and assalamu alaikum. I'm Dr. Shahana Zaman going to present. My topic is cardiac myxoma, multiple phases of a common entity. Cardiac myxomas are the most common primary neoplasm of the heart. It can arise from any chamber of the heart, but the left atrium is the most commonly affected. Less commonly, myxomas are biatrial or middle chamber in origin. The latter may be a part of Carney complex. The clinical presentation of cardiac myxoma depends on their location, size, and mobility, typically presented by triad of intracardiac obstruction, embolization, and constitutional symptoms. Sometimes they may present with atypical features. Here, I'm going to present 7 cases of cardiac myxoma occurring among Bangladeshi population having originated from different cardiac chambers with different morphological features and diverse clinical manifestation, both typical and atypical. My first case, he was a patient of 60-year-old diabetic hypertensive, came with the features of ischemic stroke with left-sided hemiplegia. He had a diastolic murmur and ECG was normal. Echocardiography revealed there is a mass of mixed density occupying the left atrium attached with the interatrial septum and prolapsing towards the left ventricle through the mitral valve, and which features suggestive of left atrial myxoma. Urgent surgical consultation was sought, surgical resection was done, emergency basis, and he was diagnosed as left atrial myxoma after histopathological report. My second case was a story of a patient of middle-aged woman who consulted neurologist for her symptom of recurrent syncope. Her ECG was normal, and her echo showed a large mass occupying whole of the left atrium with less mobility and attached with the interatrial septum, and it is also suggestive of left atrial myxoma. My third case is about a young female who is 25 years old, suffering from palpitation. At the course of her evaluation of palpitation, echocardiography was done, and echocardiography revealed a large mass of mixed density occupying the right atrium, adherent with the interatrial septum, and prolapsing towards the right ventricle through tricuspid valve, suggestive of right atrial myxoma. I have come across this patient about 12 years ago. It is 2010. This young patient who is 22 years old came with the history of fever, weight loss, and haemoptysis. Our ECG shows atrial fibrillation, and echo revealed a mass occupying both left and right atrium and adherent with the interatrial septum, a larger one in the right side. Urgent surgical consultation and surgical resection was done, and he was diagnosed biatrial myxoma after histopathology. My case number 5 was a patient with a cardiovocal syndrome. This patient presented with fever, weight loss, haemoptysis, and hoarseness of the voice. Echocardiography revealed left atrial mass with severe pulmonary hypertension. Video laryngoscopic report showed left vocal cord paralysis. Surgical resection of this mass, after surgical resection of the mass, patient was improved with all his symptoms, and it is also diagnosed histopathologically cardiac myxoma. A previously healthy man of 50 years acutely come in the cardiac emergency with acute limb ischemia. And this his echocardiography, and here we show highly mobile mass which is occupied in the left atrium and adherent with the interatrial septum, and prolapsing towards the left ventricle. And it is the, we also think it is the patient of left atrial myxoma, and urgent surgical resection was done in this patient. This is a history of a patient of 32 years female who presented with fever, haemoptysis, and he had hyperpigmented macule in her cheeks. Echocardiography revealed multiple masses occupying left atrium and both ventricles. Surgical consultation, after surgical consultation, she went through resection, and histopathology showed it was myxoma of multiple chamber origin. And we labeled her as Carney's complex. The Carney's complex or syndrome myxoma consists of cardiac and non-cardiac myxoma, spotty pigmentation, and endocrine overactivity. Carney complex typically present in third decade, often have multiple tumors and high recurrence rate following resection. In conclusion, though histologically benign, myxomas are prone to cause intracardiac obstruction and embolization. Associated constitutional features may mimic inflammatory and connective tissue disorder, creating diagnostic dilemmas. Here, I compile 7 cases origin from the different chamber with different typical and atypical presentation. Echocardiography is a versatile tool for making the diagnosis and choosing the optimum management strategy. Surgery is the mainstay of treatment with an excellent prognosis. Long-term follow-up is often needed to look for recurrence. Thank you for giving me attention.